Welcome to Bariatric Friday. Today is April 22nd. I'm here with Dr. Gail Wynn. So today, Dr. Erkan is off. So Dr. Wynn is with me. Dr. Wynn, how are you doing?
I'm doing fine, thank you, Kemal.
I haven't talked to you for a while.
Yeah, no.
So good to have you. You are one of the most, when I introduce you, even though you are not part of these episodes, so I always introduce you as one of the most experienced female bariatric surgeon in the world. So am I being wrong?
No, you're right. I've been doing this for 22 years and we've done a whole lot of surgeries. We started out with bypasses, did thousands of those, then did thousands of bands, and now thousands of sleeves. So I've been around a long time.
Excellent. Now, we are going to talk about support group aspect of the bariatric surgery. But before we go to that, if we can just give the qualification for bariatric surgery, just so that our audience would know what it is.
Sure. As far as bariatric surgery, the qualifications to have bariatric surgery or be a candidate for bariatric surgery is minimally, you have to have a body mass index 40 or greater, which means you're about 100 pounds overweight or more, or a body mass index of 35 or greater with medical problems like diabetes, high blood pressure, sleep apnea, heart disease. And then in addition to that, you have to be physically able to withstand an operation under general anesthesia. You also have to be of sound mind and not have any addictions that could interfere with your success for having weight loss surgery. And as we kind of evaluate you in consultation, we will have you see several other physicians like your primary care doctor or a bariatric specialist, a cardiologist, possibly a pulmonologist, and undergo endoscopy where we sedate you, put a scope down, look at your stomach. And after doing all those things and looking at blood work, then we determine whether you are truly a candidate for weight loss surgery based on that.
Well, thank you. So as I said, we are going to discuss the support group today. Now, we did say that this, when I was asking you the question, I was actually using the same, maybe I was following the same thing. The qualification for some surgery that's going to save someone's life. Actually, it's probably wrong term. We shouldn't qualify for this. So everyone should be able to get this. Unfortunately, we are still, insurance companies, still struggling to understand this. And then we have to qualify people until they get really sick or they have to live with the really high BMI for a long time. Many people don't really understand when we tell them what our specialty is, what our program does. They think that we are just taking healthy people and just cutting their stomach just to make them like the supermodels. This is not the population we deal with. And because of that, the multidisciplinary approach is extremely important for us. And then we build this program all together. As you just mentioned, you've been doing this for the last 23 years. And in out of that last 19 years, we've been working together. And the program actually requires a lot of stuff. And we are doing really well in terms of how we are helping our patients in terms of getting their appointments, following up with their specialty. But then there's the support group part is different than following up with the specialists or the nutritionists and others. There's a different maybe aspect of that. Can you just tell us about how this helps our patients and what your role is?
Absolutely. So I run the monthly support group. It's on the first Tuesday of the month, every first Tuesday at 5 o'clock in the evening, and it can go till 6:30. Sometimes we've even gone to 7. And the whole point of the support group is giving patients the time to ask questions. Usually we have anywhere from 10 to 25 people there at one time. Currently, it's virtual, so it makes it easily accessible to all people. And I think we're going to keep it virtual just because it makes it easier for people to join. And the whole point of it is we're there for each other. There's people there that have never had surgery that are signed up for a weight loss surgery. There's people there that have had surgery 20 years ago. There's people that are struggling with weight gain after surgery. And so there's a whole bunch of different people that are in these support groups that could provide advice, provide experience, provide their thoughts through kind of the retrospectoscope as far as what they did wrong, what they would do different. They also go over things like what's the best and yummiest protein shake, what recipes are out there, how to get protein in, how to get exercise in. So it's really kind of an interactive support group. And we have it so that it's up to you whether you want to have your camera on or off. If you're embarrassed and you don't want your camera on, that's fine. So you could remain anonymous. You could put your name up or not. Most people are pretty outgoing and outspoken. However, we want everyone to feel comfortable and participate. So I leave it up to people if they want to put a nickname up and keep their camera off, that's absolutely fine. The goal with the support group is really to support you, to have your questions answered. If you're struggling, to be there to help you through it.
Sure. Now, in terms of I think the support group has two different parts, right? So one is once a month, we have the virtual actual meeting, but then there's also, we have a support group on Facebook.
Yes,
which is a private
group on Facebook, correct.
Right, so which is a private group. So now those two work differently. So you are available as a physician, as a surgeon, and not every support group is run by surgeons, right?
That is correct. We're the only physician-run support group where there's a physician there every single support group. Every now and then, if I am not available, then one of our other surgeons will step in, but mostly it's me every month.
That's that actually makes it pretty unique. And like I'm just thinking, if I was a patient, how would that help me? And because like on Facebook, it's a private group. I can talk to people who are going through the same process with me. Either they already have the procedure or they are going through the procedure. And then also then I can just join this monthly event and then I can ask questions to the expert and I can get the answers. Now, I think part of the, and I was just looking at some of my notes from our last year's event, just to kind of like better understand, because our patients do follow up with us even after the surgery. Maybe you already answered, and then sometime in these events, I have to really focus, super focus, and when I'm super focused, I miss some of the points. So just to kind of maybe repeat it, if you already covered it, like how would this be different? Like you explaining things in a support group setting would be different because I have to follow up with you at least once a year after the surgery, even if I'm doing really well. So just to kind of emphasize the benefit of the support group, because you take your time, you do this on a Tuesday night, you have a lot of obligations outside of the practice in your with your family, and you take this time, and we don't charge for this. There must be something extra that you feel like our patients are benefiting from.
That's correct. It's really free advice. And people utilize it to their benefit by keeping me as long as they need to get advice. Like I said, sometimes we go till 7 p.m. But the difference between that and say an office visit is people get other viewpoints from other patients. So especially people that are undergoing surgery and have not had surgery yet, it's great for them because they get to hear other people's experiences. And that can kind of stick in your head as far as, oh, well, I have to be successful by doing these things. because then they could learn from other people's successes or failures. The other thing is I'm not the one who had bariatric surgery. I don't know every single delicious protein shake out there, every way to get certain vitamins, nutrients that other people have found creative ways to do it. And so when you are in a support group, you have 20 other people kind of giving you advice on what they do, versus just say me or say the dietitian. These are people that have kind of lived through it, looked at their success, their likes, their dislikes, and can give you ideas as well. So I think it's from that standpoint. The other thing is when people are struggling with weight loss, it's also good to hear from veteran patients as far as how did they make it through the struggle? What did they do? And in that aspect, it really is a support group because people are really positive and they have great ideas as far as how to kind of overcome the tough times.
So in terms of maybe interesting questions or common questions you get, now I see, I'm actually on the Facebook side and I'm looking at the last question. I see a patient is worried about being on the Robb, going to have the surgery, already had the surgery on 4/19, just anxious because she was going to start the Robb, wanted to hear from others. So why would someone be nervous about getting Robb on Robb diet?
Well, it's interesting you ask. I actually did the Robb diet for 2 weeks just so I could live what our patients live through. And initially, it's terrible. I mean, you go from eating food to looking at a shake or a packaged soup or a protein bar or a protein pudding that is a lot different than, eating regular food. And so those first 2-3 days are really tough mentally for most people. But after you get through that, then it becomes kind of habit. You're actually pretty good with just, every morning what you have to do is either a shake, bar, soup, or a pudding, and then you kind of just get into a groove. But people need to hear it from other people as far as how they survived it, how they did with it. And I think that is also really good support to hear that actually you could survive it and you could live through it without really suicidal ideations or anything like that.
So I see another question, the patient who's at age 60, anyone who's over 60 preparing for gastric sleeve. I think that's an interesting question. So when we covered this, actually, patients who are going through bariatric surgery, 50 to 60, that's about 12%. And I think that's probably increasing, it may be increasing in time. Now, I guess understanding our patient is important. So you mentioned that you did the diet, and I think it was 2 years ago, Dr. Erkan and I, we tried Robb, but I didn't do the full thing. So I did like meal replacement for the 2 of the meals, and it was difficult. So when we tell the patient that you have to be on this or you have to do this, and if you don't know what that means and not understanding, like earlier session we had today, we talk about the social determinant of health and understanding what patients are going through in the home environment. And in some cases, there are difficult situations, different situations that they may be having. And I think these types of platforms, it does help them to maybe better understand what other people are going through. Now, we do have some rules on the support group, especially on the one that I'm referring is on the Facebook. So we want people to follow these rules, so they need to be kind and courteous, and no hate speech or bullying, no promotions or spam, and respect everyone's privacy. And this is a private group. When we did this last time, I'm actually looking at the number of members. It was 118 last time when you and we did this session. Right now, it's 199 total people. More people actually can benefit from these. We are sending emails to our patients who already had the surgery or who are going through the surgical process. So I'm hoping that more people can take advantage of this. Now, I think one of the maybe issues that I see, especially when the patients are losing a lot of weight after the surgery. This is, I think I asked this question, or we did discuss this issue before. When they lose a lot of weight, they feel like they don't have to come back, or they don't want to deal with this topic anymore. Like, oh, okay, I don't want to go into the doctor's office, or I don't want to have the bariatric, support, or I'm okay on my own, which is not the right approach. So I guess, is there a way to better approach those patients so then they can actually benefit from these programs that we have in place?
Oh, absolutely. I mean, the tough part is you have to realize it first that you as a patient need help. And most people, when they find that they're doing things like gaining weight back, the first thing they do is try to avoid us because they're ashamed. And I want to tell people and reach out and say, don't be ashamed. About 25% of people will gain weight back after weight loss surgery. And it's because we're human. Bad habits occur and come back. Sometimes it's stress, death of a loved one, or maybe a motor vehicle accident that kind of sets your world into a tizzy, and you have to kind of cope, and you kind of go back to the bad habits. And so really the support group is there to help people through that. And although we send emails to pretty much everyone we've operated on, sometimes it could go to spam, so they don't get it. Oftentimes, you're right, Kemal, they look at it and say, well, I don't really need this. I'm doing fine. Well, you're doing fine until you're not doing fine. And once you're not doing fine, then it becomes almost desperate. Sometimes people will gain 10, 15 pounds, get desperate and start doing weird diets and falling off track and gaining more weight. So what we would like to do is say, listen, the support group is here every Tuesday, first Tuesday of the month. Just join. If you feel like you're struggling, just join. Get the advice, get the free advice, get the support that you need. And don't do it when you've gained 50, 60, 70 pounds. Do it when you see that you're gaining 2, 3 pounds. Do it when you see bad habits starting to come back and see that you're starting to struggle again. Do it when mentally you feel like, oh my God, I'm in a bad place, or I'm heading in a bad place. Let me do something about it. So you want to do it early rather than wait till you've gained more weight than you could try to lose.
So I think one of the other things that I will mention, our patient satisfaction score, as you know, with the American Surgery Center, we run the patient satisfaction on a daily basis, but then we look at the scores monthly, quarterly, and when we look at the 12 months, right now we are at 99.7%, which we've been maintaining that for a long time. So that actually is, it's hard to achieve and then hard to maintain. And we are doing that because we have surgeons like yourself in our team, our nurses, our medical staff. This is everyone all together, team effort. So anything that we want to tell our patients at this point that we can maybe make a change in their process?
I think come to the support groups. Number one is if you're not struggling, you could help someone else who's struggling. So kind of paying it forward. Number two is it really helps you stay on track. The people that tend to have problems with weight regain and struggle are actually the people that don't follow up routinely. So aside from routine follow-up so that we could catch problems and bad habits or possible complications early, also come to the support groups so you can help make a positive impact for other people or even learn something new on your own. And usually like when I go away for conferences for CME, I always say if I could learn something new, like one or two new things, then it was worth it. And so hopefully the support group will provide that for you as well.
All right. Well, Dr. Wynn, thank you so much for joining us. I know weather is really nice out there, and I don't know if you're on call today. Hopefully not.
I am.
You are. So, well, let me know if you need anything. Thank you for joining us, and we'll see you soon. Have a great weekend. Thank you.
Thank you, Kemal. Bye-bye.
Bye-bye.